Hello and welcome to Medtalks with Dr.moin. Today in our studio we have esteemed cardiothoracic surgeon Dr. Rajshekhar Rao. Dr. Rajshekhar Rao is a cardiothoracic surgeon. He is the head of the department cardiothoracic surgery and he has been working in care hospital since 2000. Sir, I know that you have been in care hospital since long time.
First of all, thank you, Dr. Moin, for inviting me to your Medtalks with Moin.
Pleasure, sir.
Following it up regularly, and it has been a great journey. I've been following all your interviews and everything.
Cardiothoracic surgery. They used to call it cardiothoracic and vascular surgery, right, sir?
Correct.
So, could you just brief us and tell our viewers what is cardiothoracic surgery and what does it deal with?
Basically, cardiothoracic surgery, cardiothoracic and vascular surgery. ఇనిషియల్గా ఎర్లియర్ డేస్ అంటే ఏంటంటే కనుక 90s to 2000s the cardiothoracic and vascular surgery used to be the super specialty course. So myself, I got MCH in cardiothoracic and vascular surgery. So we were supposed to do heart surgeries, thoracic surgeries in the sense that surgeries of the lungs, esophagus, all thoracic organs, as well as vascular surgeries. Like arteries of the all vessels, all peripheries, central, everything used to operate. Then what happened with the the medical field is evolving all the time. So now it has split into different multiple subspecialties in one super specialty. Now cardiothoracic and vascular surgery now has gone branched again into cardiac surgery, thoracic surgery,
and
vascular surgery itself. So now for example, I do purely cardiac surgery. I do minimal access cardiac surgeries. I do heart transplants. I do ventricular assist devices. So that is my specialty, and I don't want to diverge myself into different fields, because ultimately I personally believe and feel that the most important for any doctor is to give a complete treatment to the patient. For example, if I can focus on one particular, say that my specialty is a total artery revascularization in a bypass surgery and heart transplants and ventricular assist devices. That is my specialty. So I always try to focus on those things, more important than any other things. As we grow wiser and growing old,
you would like to do something what you want to, and
yes,
and what you are born to do.
Yes, it becomes our passion,
Exactly.
As a surgeon, better.
Sir, coronary artery bypass grafting. So, sir, they call it bypass surgery to cut it in short, and some people call cabbage. So, what is this surgery and how do you operate?
Thanks for this nice question, actually, because I must tell you honestly, coronary artery bypass surgery, people call it cabbage, CABG, and everything. It is the most commonly done operation in the world. Nowadays, the single most common surgery that is done in entire world is coronary artery bypass surgery. Coronary artery disease means heart as an organ, it's like a pump. It pumps blood to the entire body. But since it is a muscular pump, it needs blood supply to itself. The heart muscle needs blood supply.
While it is supplying blood to the entire body, it needs blood to itself.
So the so-called coronary arteries are the arteries that supply blood to the heart. Now, earlier I mentioned about coronary artery disease means these coronary arteries that supply good blood to the heart, if they get blocks, like because of the cholesterol deposits, the blood stream through the coronary arteries gets narrowed. So that is when we call it coronary artery disease. It is detected by the ECG, echo, and other means, and it is confirmed by doing a coronary angiography. Basically, by injecting a dye into the coronary arteries, we can see which part of the coronary arteries is narrowed and what kind of a treatment we can offer. So when the coronary arteries get a blockage more than 50%, then we need to do something. Suppose we have got a right coronary artery and a left coronary artery. With right coronary artery again divides into two branches, left coronary artery is again divided into two branches. So you can say that conflictly there are four
Okay. So
major
there are
arteries and
basically there are
branches.
four arteries.
Four arteries.
Okay.
So if one or two arteries are blocked, for example, and the blockage is little in the sense that if the blockage is about 2 mm, 3 mm kind of a thing,
Okay.
discrete blockage, you
Okay.
can say. If blockages are discrete,
Mm-hmm.
then probably a stenting would be an ideal option.
Okay.
But if there are multiple blocks
Mm-hmm.
in the coronary arteries
Mm-hmm.
and the blocks are at multiple places in a single coronary artery, for example,
Mm-hmm.
where stenting is not possible,
Okay.
then we do what is called a coronary artery bypass surgery or a cabbage.
Right.
So that means in common terms, the blood supply to the heart is reduced because of the blockage in the coronary arteries. Now we give an extra channel.
So we have bypass roads
Yes,
around the city.
to bypass the traffic.
So you
and
give
all.
extra channel
Yes,
beyond the blockage.
beyond the blockage
Right.
to provide uninterrupted blood supply to the heart muscle.
Okay.
So that is what we achieve by doing a coronary artery bypass surgery. Now there are different methods of doing it. For example, we use different ways to achieve this bypass.
Okay.
We use arteries, and then we use veins taken from the legs,
Right.
and we use different arteries from the different parts of the body taken to do that. For example, we use internal mammary artery
Okay.
on one side, left side, or we use bilateral internal mammary artery from the right and left as well as
So those are the internal mammary arteries are the arteries which are in your chest,
in the chest,
in the chest, left side and the right
left side, behind this bone.
Right.
These arteries, we harvest them and we use them to create bypass to the heart.
Okay.
And then sometimes we take arteries from the hands, radial arteries.
Radial arteries.
We take them. And then sometimes we take arteries from the abdomen.
Oh, is it?
Yeah, gastroeploic arteries.
Okay. I
So
never
we
heard
take
about
them.
this, sir.
Yeah, gastroeploic arteries we take.
Okay.
But it is not very commonly done.
I just see that most of them are like radial internal artery or saphenous, right?
Correct. But I must admit and tell you, for any surgeon, for you or for me,
Sir.
most important point is the outcomes of the patients.
Exactly, sir.
So the one treatment is not sufficient or meet the demands of each and every patient.
Applicable for everybody.
Yes, we need to customize.
Customize.
So I always prefer to customize my patient's treatment based on their disease and requirements.
Okay.
For example, I don't do total artery revascularization for a 70-year-old gentleman
Okay.
because it involves, if I take two mammary arteries from a 70-year-old gentleman, his breastbone goes for toss.
Okay.
He will have sternal wound infections and problems.
Okay.
So, which can be disastrous sometimes. So, we apply a lot of judgment in offering treatment.
It's like a tailor-fit job.
We don't do same thing for everybody.
Okay.
So, that's what
Another vessel you take from the leg, it is called
saphenous vein.
saphenous vein.
Yeah,
right?
yeah.
So, which is like better, it is you who has to decide, not me or anybody or not the cardiologist. Basically, the cardiothoracic surgeon will decide internal mammary or the radial or the.
Yes.
So, the goal of doing a CT surgery is to restore the blockage, blocked
Arteries.
blood supply.
Yeah, bypass the blocked arteries.
So, thank you so much for talking to our viewers about bypass surgery. Now, sir, there is another term I heard about it. They call it open heart surgery. Open heart surgery. So, what is that open heart surgery? Do you really cut open the heart?
It's a very good question actually. A lot of people,
Sir.
lot of patients who I see in the OPDs, they keep on asking, sir, is it a open heart surgery? Do you cut open the chest? Do you make a big cut here? All those things. So, I will elaborate those things. Actually, there are two ways of looking at the thing.
Okay.
Open heart surgery, if you clearly see, cutting open the heart to do it. Okay. And people are afraid of the term. A lot of people are afraid of that term.
Right.
When we say open heart surgery, they are worried. Sir, heart is open, how is he going to survive, and all those questions they ask.
Right.
But I always tell them, tell the patients that open heart surgery means when there are problems with heart valves
Within the heart.
within the heart.
So you cannot reach them externally.
Externally, you cannot reach them. You have to go inside the heart to fix that. For example, heart has got 4 chambers, 2 on the right, 2 on the left.
Right.
And each chambers are connected with valves,
Right.
by valves, like doors
Right.
of
2 rooms.
2 rooms.
Right.
So the 2 chambers of the heart on right and left side, they are connected by means of valves. Suppose if the valve between 2 chambers is narrowed or is diseased and the blood supply is leaking back,
Right.
we call it regurgitation.
Regurgitation.
So in those situations, we do open heart surgery.
Right.
For example, heart has got 4 valves:
Right.
mitral valve, aortic valve, tricuspid valve, pulmonary valve.
Right.
If any of these valves are diseased and requires fixation, then the particular patient definitely needs
Open
heart surgery.
Right.
Otherwise, our open heart surgery is used as a misnomer for common people, because they always believe that whenever we cut the breastbone open like this, they think that is open heart surgery.
It's a misnomer.
It's a misnomer. That's not open heart surgery
Right.
actually, because we have to have access to heart
Right.
to do any surgery on the heart. For example, earlier we discussed about coronary artery bypass surgery.
Right.
The coronary arteries are on the surface of the heart.
Right.
So they don't
They
go
are like superficial.
They are superficial. They are on the surface of the heart. And what we do is we do bypass surgeries on those coronary arteries using a technique called beating heart surgery.
Okay.
So we don't earlier days, like for example, back in 90s and even in early 2000s, people used to do bypass surgeries on arrested heart. Means the heart is stopped
Right.
from beating and patient is supported using what is called a heart lung machine.
Okay.
So the heart lung machine basically has an artificial lung which
Supplies
oxygenates the blood
blood.
and returns it back to the patient.
Right.
So on arrested heart, we used to do bypass surgery. Now with the advent of a lot of the hardware, we got what is called octopus stabilizers.
Right.
So they basically what they do is, even if the heart is beating, they will keep the area of interest, the area where the coronary artery is there,
Immobilized.
gets immobilized,
Right.
relatively immobilized, not
Right.
completely, but relatively immobilized, where we can operate.
Okay.
So nowadays I do every month 45 to 50 bypass surgeries.
All of them are beating heart?
All of them are on beating heart.
Okay.
Unless very rarely, maybe once in blue moon,
Okay.
if a patient is not supporting or if blood pressure is not, not able to be maintained,
Okay.
then we go on bypass.
Okay.
Even on bypass also, we keep the patient on bypass, we support the heart, but we don't arrest the heart.
Heart.
So that is called a beating heart bypass surgery.
Beating heart beating.
Beating heart bypass. So heart is on heart lung machine. Patient is kept on heart lung machine to support the heart and lungs. So heart is relatively free, but it's still beating. So we do beating heart surgery on that.
Okay.
So all these things help the recovery of the patients.
Okay.
Like I said earlier, the outcomes matter a lot. Outcomes means the end result. It's not just how we do surgery.
Right.
The patient has to go home
Yeah.
and the patient has to come back for review and the patient has to be on follow for next 5 to 10 years.
Exactly.
That we call it a short-term result, mid-term results and long-term results. So my focus is always on having a fantastic short, mid and long-term results.
Okay.
The one way of achieving those things is by planning the surgery clearly. So I will not do a total artery revascularization for a 75, 80-year-old patient. At the same time, I won't do a bypass to a young man, a 30-year-old software engineer who requires a bypass surgery. I will always try to do a total artery revascularization for him.
Okay.
Because that is required for him. He has to go for a long time.
On a long run, that is going to be beneficial.
Because arteries are always beneficial to the bypass surgery.
For people to know, opening the chest is not just bypass surgery or open heart surgery. For bypass as well as open heart surgery, they open the chest, right? Then they do bypass surgery. Bypass surgery is they don't cut open the heart superficially, they just bypass the grafts,
Correct.
put the grafts. And for valvular problems, they just cut open the heart. But it is a safe procedure, and it is very easy to do nowadays with the reputed surgeons around us and the technology and bright hospitals we have around us. So they replace the heart valves and they repair the valves and they close it.
Correct.
So this is something about open heart surgery. Sir, now talking to you about a new term, I have been hearing about it. Minimal access surgery, minimal access surgery. What is that, sir?
See, basically, the conventional heart surgeries means we open the breastbone.
Right. To cut open the
To cut
sternum.
open the sternum from
and
here
open
to
the
here,
chest, right?
open the chest. This is the conventional heart surgery, where we cut open the breastbone.
Okay.
And we do minimal access surgeries. Minimal access surgery is nothing but using sharp incisions.
Okay.
So, for example, we have got an aortic valve replacement to be done.
Okay.
So, we make a sharp incision in the upper part of the sternum.
Okay.
It's only about 2 inches.
Okay.
We cut part of the sternum and make a T cut here,
Okay.
and then do that. That is a minimal access surgery.
Okay.
And for example, if a patient has got a hole in the heart, for example, atrial septal defect. So in those patients, what we do is we make a small cut, about 2 inches cut in the right fourth intercostal space.
Oh, right side, not in
Right
the
side
left
chest,
side. Okay.
not in the midline.
Okay.
We make a incision here,
Uh-huh.
a small, especially below the breast, especially for females. It is very cosmetically appealing, and you won't see it.
Okay.
So that is called minimal access surgery. Minimal access cardiac surgery means doing cardiac surgeries using small incisions.
Okay.
For example, minimal access bypass surgery. So we make a small cut in the left chest, small cut in the left chest,
Okay.
and then we harvest the left internal mammary artery,
Okay.
and again we do bypass surgery on a beating heart
Okay.
through that small incision.
Oh, does that give enough window to do that, sir?
Yeah, it's fantastic exposure.
Okay.
Because you have to see to believe it.
Okay.
And people have done bilateral mammaries also with minimal access.
Wow.
But not everybody, I won't be doing that.
Okay.
Because it requires a lot of, the physical strain.
And a different type of skill?
Skills part is easy. Only thing is that your back goes for a toss.
Oh my God.
Yeah, you have to go like that, like this.
Achha.
The position is bit odd.
Okay.
So if you do 2 cases, and then you're gone.
So no matter whether you do the minimal access cardiac surgery or cut open the entire chest, so you will be doing the same job.
Yeah, if I cannot do the same job through minimal access surgery, I won't be doing it. I'll be doing a regular conventional surgery.
So you decide that before.
Yeah. Ultimately, if we cannot do what we are supposed to be doing, then there's no point in doing the surgery at all.
True.
So we have to, the final goal is the same. For example, if I have to do a bypass surgery,
Right.
I have to do 2 bypasses or 3 bypasses or 4 bypasses. If I'm able to do it through minimal access surgery, I would be happy to do that. Suppose if I can't do that, if I have to compromise on the quality of surgery,
There's
or
no point,
there's no point
doing
doing minimal access surgery.
True. So it's a very open and it's a very frank answer sir has given. So whatever you can do, whatever the justice you can do to the patient, sir will decide beforehand and choose the patient.
Correct.
Thank you so much for talking to our viewers about your experience in cardiothoracic surgery.
Thank you, Dr. Moin.